Today we're joined by three additional members of my cabinet: Department of Human Services Secretary Grace Ho, Department of Veterans Affairs Director Linda Chapa-Lavia, and Department of Children and Family Services Director Mark Smith. Along with my administration's commitment to maintain the critical services that our residents need during this crisis, we're also responsible for protecting the health and safety of the state employees who deliver those services. I feel extremely fortunate to have an incredible team by my side every day, including the cabinet members leading the Emergency Management Agency, Public Health Department, Human Services, Children and Family Services, and of course my governor's office staff, all of whom are working day and night to see Illinoisans through the public health crisis that we're going through today. I just want everyone to know that when we talk about essential workers, that includes the many, many public servants who are among those saving lives and making life a little bit easier for all Illinoisans. As I announced a few weeks back, just like many businesses, our state agencies have directed many of their employees to work from home. In addition to Dr. Ezike, the three individuals behind me today, Secretary Ho, Director Smith, and Director Chapa-Lavia, lead three of the agencies that provide critical services that our workers can't do from their homes. I've asked the three of them to join today's daily update so that you can hear directly from agency leadership about how they are managing to provide those services in the midst of the COVID-19 pandemic. For those who are less familiar with the workings of state government, there are frontline workers at these agencies who spend their days and nights caring for our most vulnerable Illinoisans, even in normal times. Those responsibilities don't go away during a global pandemic, and in fact, they become even more critical. At the Department of Human Services, for example, state workers at our mental health hospitals and centers for people with disabilities, developmental disabilities, continue to serve adults and young people in their care. At Children and Family Services, our investigators are protecting our children and families by responding to reports of alleged abuse and neglect that continue to be reported on our hotline. And for Veterans Affairs, our teams at our veterans homes are ensuring that our state's military heroes receive the care that they deserve. I want to express my gratitude to these state workers who have made public service their life's work. They're still doing their jobs every day, spending hours away from their own families to care for some of our most vulnerable residents. They too are heroes. In just a moment, I'll have each of our directors talk more specifically about their department's COVID-19 responses, but here's what I can assure you across the board. Early action in all of our agencies helped to shape existing emergency plans specifically to the needs of our COVID-19 response. They put in strict procedures around visitors in state-controlled facilities, adding new staff, health checks and policies, directing as much of our PPE stock as we can to our state frontline workers, and communicating regular updates to family members and other designated contacts of those that are in the state's care. All of our actions have centered around a singular focus: protecting our most vulnerable residents and doing everything possible for their health and their wellness. Additionally, in agencies like the Department of Human Services and the Department of Veterans Affairs that have had to close many of their local offices that residents visit for services, we've enhanced our online and phone options to ensure a continuity of service. Our directors will give you the specific contact information for their agencies, but let me be clear, there are no DHS or DVA public benefits that require face-to-face appointments in the office at this time. We're working to increase access to services like Medicaid and food assistance to Illinoisans who find themselves newly in need of help. This is a really, really hard time, financially and emotionally, for adults and children alike, and overall for too many people all across our state. Please know that we in state government are working hard to support you in every way possible. Before I turn the podium over to Dr. Ezike, I want to remind you of one other thing. For 37 years, the month of April has been recognized as National Child Abuse Awareness Month in the United States. Because of the current circumstances, we have a harder time bringing the traditional amount of awareness to this important concern. But in this moment of heightened social isolation and stress, two of the key factors for the risk of child abuse, it is so important that all of us pay attention. Every child deserves a healthy childhood, to live in a nurturing, loving home free from abuse and neglect. Even during these times of social distancing and shelter in place, there are still simple things that we all can do to keep children safe and to keep our communities strong. Text or call a neighbor who is struggling. Offer to pick up groceries for a family and leave them on their front porch. Share tips for overcoming parenting challenges on social media. In these stressful, uncertain times, reach out to let families that may be in crisis know that they're not alone and that there is help available. So thank you, and now I'll turn it over to Dr. Ezike for today's medical update.
Thank you.
Doctor?
Thank you, Governor. Good afternoon. I'd like to begin today with a simple plea. Please continue to stay home. This will help Illinois flatten the curve, but we all must be willing to do this. You might say, oh, kids planning meetups outside but promising to social distance. We know how quickly that will devolve into someone showing something on their phone, and now you'll have 4 or 5 people encircling around a small phone. We all have to do what's necessary. The beautiful gestures that Governor referred to, dropping food at someone's doorstep, that's great. But the gesture of touching someone else, that's not what we want at this time. We can defer those moves now so that we can enjoy our connections later. Today, we have to report that Illinois has surpassed 10,000 cases of COVID-19. The number is sobering and reminds us that it's critical that we all do our part. The more cases means the more hospitalizations. The more hospitalizations means more deaths. So every gesture or gesture that we forego can help decrease our deaths. We added 1,453 new cases and unfortunately 33 new deaths. We have a total of 243 precious lives lost. We have seen clusters of cases in nursing homes, in assisted living facilities, correctional centers, mental health facilities, and developmental facilities alike. My colleagues and my friends from my sister agencies will be talking about the measures being taken to protect those residents in those facilities. And I want to touch on the difficulty of preventing the virus from infiltrating these congregate settings and the challenges of stopping that spread. The natural movement of people needing to come in and out of those settings, even when they're decreased to the minimum amount, still causes a lot of people moving around and increases the potential for introduction and rapid spread of the virus into people who live, eat, and recreate all in the same space. Options for medical isolation of these COVID-19 cases are limited and vary depending on the type and size of facility, not to mention the residents who are already in isolation for other medical conditions. Ideally, people who are positive should be isolated individually, and close contacts should be quarantined individually. However, that can't always be possible given the constraints of space and rooms. We are focused on helping these facilities and protecting the health and safety of their residents. Public health officials have been going on site to provide guidance on infection control practices, such as donning and doffing PPE, gloves, gowns, and masks. We've also tried to do most of our advice from phone, just to minimize additional exposures. We are working with medical staff and physicians who work in these settings on isolation and quarantine guidance and healthcare triage. Although you may not think so, everyone has a role to play and everyone can help. By staying home, you reduce the amount of virus spreading in the community. That reduces the chance of someone being infected. And that person may then go into a facility and have the unforeseen consequence of infecting a very vulnerable population. So let's all do what we can to prevent that possibility. Stay home, and let's be all in for Illinois and do our part to end this pandemic. And now a brief summary in Spanish. Buenas tardes, me gustaría comenzar hoy con una simple petición. Por favor, si puedes, quédense en casa. Esto ayudará a Illinois a aplanar la curva, pero todos debemos estar dispuestos a hacerlo. Hoy, IDPH informa que el Estado ha pasado 10,000 casos de COVID-19 aquí en Illinois. Este número nos hace pensar y nos recuerda que todos debemos hacer nuestra parte. Desde ayer hay 1,453 nuevos casos de COVID-19, incluyendo 33 muertes. Tenemos un total de 10,357 casos y 243 muertes en Illinois. Hemos visto casos en todas partes, en asilos de ancianos y también en los centros correccionales. Los colegas de mis agencias hermanas hablarán sobre las medidas que están tomando para proteger los residentes. Quiero decir que es difícil para el virus que entra en estos lugares. El movimiento natural de las personas que necesitan entrar y salir de estos lugares aumenta el potencial de introducción y transmisión del virus. Idealmente, las personas positivas deben aislarse individualmente. Sin embargo, esto no es posible de hacer todo el tiempo. Estamos enfocados en ayudar a estos lugares y proteger la salud y la seguridad de sus residentes. Las oficiales de salud pública están ayudando sobre prácticas de control de infecciones. Aunque no lo crean, todos pueden ayudar en estas situaciones. Quédese en casa, reduce la cantidad de virus que se transmita en la comunidad. Por favor, si hacemos nuestra parte poner fin a esta pandemia, todos vamos a salir adelante. And with that, I will turn it over to Director Chapalavia of the Department of Veterans Affairs.
Thank you, Dr. Gazi, my friend, my sister, my hermana. You don't know how important it is that the Spanish language people get to hear your voice every day. We hold you in our prayers. Governor Pritzker as well, thank you so much, and good afternoon, everyone. The health and safety of our military veterans and those devoted staff who care for them is and always will be the top priority of the Department of Veterans Affairs under this administration. On March 11th, each of our veteran homes were directed to restrict all visitation to non-essential personnel. Our residents have been encouraged to stay in their units and minimize movement within their facility and are staggering mealtime whenever possible. All employees and essential vendors are subject to pre-shift health screening to include temperature checks twice daily. We are contacting all resources and stocking up on and reviewing protective equipment inventories, and everyone remains highly vigilant for any signs or symptoms of COVID-19. Thanks to the tireless efforts of Team IDVA, I love you all, we are grateful to have no known cases to date at our long-term care facilities. We are responding to a single positive case in an employee at our Prince home at Manteno, which is a standalone building on the Manteno property that provides housing and supportive services for our homeless veterans. The employee is home recovering. Our prayers are with them and their family. The home is following recommendations from local health officials with implementation assistance from the Department of Public Health to continue protecting everyone there. Our facilities are prepared for COVID-19 if cases do occur. We will work with the guidance from the Illinois Department of Veterans Affairs, our local health officials, to isolate hospitalized residents as appropriate and protect other residents and our staff from transmittal. As we move forward, we are encouraging everyone to video chat, call, and write to their loved ones at our homes. We encourage you to visit our Facebook page at Illinois Department of Veterans Affairs and leave a comment or a message, not only for our veterans, especially those that do not have family, but for our nurses, for our VNACs, for our kitchen help, for our household help. Everyone is important and everybody should be acknowledged. In addition to our homes, we have service officers to assist veterans who need help navigating the system of the federal and state benefits available to them and their families. Our physical offices have been closed, but our department remains dedicated to serving the needs of our families and our veterans. Any veteran can find their local service officer's email or phone number or fill out a web form to be contacted at our website. That's veterans.illinois.gov. Once again, that's veterans with an S.illinois.gov. Our veteran heroes and the devoted staff who care for them are strong and resilient. They know how to work hard and push through. With everybody working together safely and the support of our wonderful communities in Anna, Quincy, LaSalle, Manteno, and this administration in this state of Illinois, we know we can get through this together. Thank you for being all in Illinois. I am proud to be not only on IDVA team, and I love you all, but also Team Illinois. With that being said, I'd like to welcome my brother, Director Mark Smith from the Department of Children and Family Services to the podium. Thank you.
Thank you. Governor, thank you for your incredible support that you've shown the Department of Children and Family Services every day of this crisis. To my fellow leaders here today, your collaboration over the past few weeks has been inspiring. The network of organizations that make up the child welfare system in Illinois are completely dedicated to keeping children safe during this crisis. DCFS is central to the child welfare system, but we never do this work alone. Our partners in the private sector make up 85% of the workforce that protects children. Every day we work hand in hand with judges, state's attorneys, law enforcement, the ACLU, the Cook County Public Guardian, and with Child Advocacy Center, and with hundreds of social service organizations that support our children and families. Our internal emergency planning team has worked closely with other agencies like IDPH and IEMA, who are experienced in responding to infectious disease outbreaks. Together, we have made urgent and necessary changes to our system in response to the spread of COVID-19. Here's what that means for our families and the communities that rely on our system of care. Based on Governor Pritzker's decisive action to protect our state workforce, today, 88% of our DCFS workforce no longer report to an office. But even with that change, we are still providing the support that families and communities depend on. I am proud to announce that every call floor worker at the Abuse and Neglect Hotline for the past 2 weeks, every call floor worker has been taking calls from the safety of their home. In addition, we are allowing caseworkers to practice social distancing while they continue to check on the well-being of our kids. Starting on March 20th, DCFS announced new guidelines for caseworkers, residential monitors, and birth parents, giving them the ability to use phone and video to replace many of their in-person contacts with their children. However, the reality is To ensure that we are keeping children safe, and some in-person contact must continue. DCFS has provided protective gear to our frontline staff and to the staff of our private partners who have asked for assistance. Over the last 2 weeks, DCFS has distributed more than 400,000 protective gloves and 15,000 masks and disinfectant and cleaning supplies across the state. We are continuing to work with IEMA and other sources to acquire more protective gear, including a shortage of child-sized masks. DCFS is extending services for any youth in care aging out of the system through this crisis, including any youth that have aged out in the last 6 months. This particularly vulnerable population needs the help of housing and other expenses, and we are making every effort to give them what they need. DCFS has also increased board payments to our foster parents for March and for April to assist in additional expenses they are facing. And we are providing additional funding for foster care, intact, and residential providers to assist with COVID-related issues. I share these examples to demonstrate that we are rapidly adjusting our system to care for so we can balance the needs and reduce the spread of the virus. With ever-present needs to protect our children from the dangers they face, even in the best of times. This work will not end. DCFS will keep adapting and responding to changing nature of this crisis. And with this action we must all take as a society, we will continue to assess how these disruptions bring new threats to the well-being of our state's children. There are countless heroes who are serving on the front lines every day to protect us from the coronavirus. Among the medical personnel and first responders, let us also count child protection investigators and caseworkers who leave their homes bravely every day to protect the children from the harms of abuse and neglect. I would like to personally thank every DCFS employee from our fiscal department who ensure checks go out, to our IT partners at iDoIT who have ensured that we can continue to protect and serve our children, and to every child protection investigator and case manager who has put themselves in harm's way to protect our children. And most lovingly and supportingly, our foster parents who have kept and maintained the care for Illinois' children and stepped up as a true leader in the demonstration of the heart and love we have for our families. Thank you. I'd like to welcome Secretary Ho to the podium.
Good afternoon. I'd like to echo the sentiment and gratitude to our public servants and also express my deep appreciation for all of the staff of the Illinois Department of Human Services and of course our 500-some community partners that work with us every day for the people that we serve. Our work requires human connection. We are human services. So like other first responders, most of our staff can't stay at home because they are every day ensuring that Illinois residents have food on their table, shelter, housing supports, and have access to health care, receive psychiatric care, and are safe. And so we have a delicate balance and have to think strategically as we develop and enact safety precautions as our work requires human connection. DHS has a multifaceted plan in motion that is tailored to each type of setting that is under our purview and that factors in our state's access to PPE and other supplies. The governor has shared almost every day that the state is grappling with the federal shortage of PPE. We're working with the governor and IEMA to overcome this the best that we can. We know from the data and experts that our job is to flatten the curve. We know that our DHS population of patients and residents may be affected by COVID-19 more than the general population because of their underlying medical conditions. We are taking every precaution to ensure that we anticipate and care for those individuals in our system who may become very ill. Nevertheless, we know that these cases are agonizing for families and for our staff, and we will continue to be as responsive and transparent as possible for everyone involved. When the crisis hit, DHS immediately created an infection control team that has guided us and advised us through all of our efforts in every setting. With this team and guidance from CDC, IDPH, and IEMA, we have used science and data to influence our actions. Our 14 24/7 facilities across the state serve about 3,400 people a day, with about 6,500 staff who come to work every day. On March 12th, we took the forthcoming actions. We initiated health screenings, including temperature checks for all staff at every shift change and sending staff home for fever or any other COVID-related symptoms. We halted non-essential visits to our facilities. All group activities or community off-campus outings were canceled. All residents' vitals were taken in the morning as well as in afternoon shifts. Continual training of staff regarding sanitation and hand washing has been ongoing. We've provided PPE following the guidance from IDPH and the Centers for Disease Control and Prevention. We've enhanced cleaning on frequently touched surfaces such as doors, handrails, and light switches. Individuals who exhibit signs and symptoms of COVID-19 are placed in isolation immediately. In addition to the meticulous tracking of residents, we are tracking every day the utilization of PPE supplies and what is available down to the individual glove at every facility. Our 124 public-facing local offices across the state generally serve millions of people each day. That to ensure the safety of our clients and our staff, we've been quickly building capacity online, and we have, over the course of the past several weeks, migrated staff to work from home to the greatest extent possible to comply with social distancing guidelines for their health as well as the safety of our customers simultaneously. This past Monday, we closed all but 13 public-facing offices and urged people to stay at home and to access services online and by phone. We made the hard decision to keep these few public-facing offices open so that community members had at least some in-person opportunities to meet with our caseworkers. What we've done to keep our caseworkers safe when possible, we've installed plexiglass barriers between community members and staff, made hand sanitizers as well as PPE when possible, and engaged in deep and frequent cleaning of these offices. Simultaneously, as the governor had mentioned, our case volume for these public offices has skyrocketed this past week by more than 170%. It is clear that the needs for people in Illinois has increased dramatically. And so we continue to urge you to apply for these important services online. www.dhs.illinois.gov #HelpIsHere. Our 500+ community providers across the state provide critical supports and services as well. We have sent over 35 guidances over the past several months because we know now more than ever that communication and clarity is key. We've increased flexibility in funding and programming and are enabling our community providers to tailor their services for the areas of their greatest need. So in closing, I want to reiterate the following. As other first responders and essential operations have, DHS has a delicate balance and has to think strategically as it develops and enacts safety precautions as our work requires human connection. We have a multifaceted data and science-informed plan in motion that is tailored to each type of setting that is under our purview and that factors in our state's access to PPE and our other supplies. And we try to do all of this, as we do every day, with compassion and care. Thank you very much. Governor?
Thank you. Happy to take any questions from members of the media in the room and those online.
Good afternoon.
Good afternoon.
Thank you. My name is Eric Rong. I'm with WGN-TV. I have a number of questions from a number of colleagues as well.
Great.
The first one that I want to ask is from Tia from Fox 32. It's actually for the doctor. There are reports saying that this virus impacts African Americans more. Are we seeing that in the state of Illinois? If so, why is that?
Right. So we are still early in this disease, but we have, some information in terms of the people that it has been affected. We'll continue to follow it, but if that were to bear out, I think as we put on our health equity lens, we already know before COVID was ever established that the health outcomes for various communities are already different, and those were already things that the Illinois Department of Health and all of our local health departments have been very keyed in on how to narrow those disparities. So if you know that those disparities exist in terms of health outcomes, you can imagine that overlaying a new disease is only going to exacerbate whatever inequities already exist. So the departments of health at the local, state level will continue to try to address these disparities, but as I'm saying, it's early, we're still looking at our data, but if that were to bear out, we would not be entirely surprised because we know what the existing baseline is.
Doctor, while you're at the podium, I have a question for you myself. The tests that are either in the works or could be coming out here very soon that could tell if somebody had the virus, how big of a game changer would that be?
Yeah,
and when could we expect them?
Yes. So those tests are ramping up. They're in limited production now, but they're going to grow. So that is something that we're all looking forward to. We know how important, how hard the governor has been working to help us to get more testing. And so I think even through his personal connections, he's helping us to get that going faster. So absolutely, if we know people who have already been exposed, there's an assumption that there's an immunity that comes after being exposed. That's what this test would be looking for. So that would actually help us to figure out how many people are still susceptible in our community, because we're thinking that the people who have already experienced the disease, whether symptomatically or not, are now out of the denominator of people who are still susceptible. And so that tells us how many people are still left to be infected and help project where that would be going from then on.
May I just add to that? This is you said, is it a game changer? First of all, they have the ability to do this test today. It's not in mass form, so we can't do it as many of those as even we can the COVID-19 test today. But it will be. It will be readily available. And why is it so important? Because as the doctor said, if we know that a certain number of people are immune, and we know that that population is increasing because more people are getting COVID-19 and vast majority are recovering from COVID-19, so they develop the antibodies. Well, those people, in theory, are free of the virus and can't get it again, and therefore, when you start to think about how you reopen everything, having herd immunity, we're a long way from that, but knowing that in some community, perhaps you've got a large number of people that already had it and recovered, would be a very important thing for, beginning to put life back to some semblance of normalcy.
Do we have any sort of timeline on when they might be available to the masses?
It's getting there. I don't know. Nobody's told me, that, 4 weeks from now we'll be able to do this in mass form. But suffice to say, I think as one of the glimmers of hope here is that we'll be able to know if you've had it, because there are many people, this may sound strange to people, there are many people that have never been tested. They got it. They had some symptoms, but they weren't drastic symptoms, and they recovered. I don't know what the numbers of those are, but that is at least what many of the scientists say now. And so the result is, you may already have had it, but again, I don't believe that it is a very large percentage. It's just that we would like to know, you would like to know, indeed, if you already had it and therefore were immune from it. And so I think we should work on that. But right now, what is most important is the testing on the front end. If you haven't had it and, yet, and we can test you and tell you if you have it now, that's very important for the kind of care that you would get now so that you can more easily recover.
And Governor, this one is from Laura from ABC7. Can you please ask the governor about PPE supplies sent from the federal government? A White House Deputy Director of Media Affairs tells us Illinois has received more than 500,000 N95 masks, as well as other types of masks, face shields, other equipment, and 300 ventilators, as well as 1 million MREs for first responders. Is this equipment in use in Illinois, and where do we stand on supplies?
Well, I can't go through every single one of those items of PPE, but let me give you an example of something you just read off: 500,000 N95 masks. Listen, we'll take everything we can get. So 500,000 is, you know, I'm thankful for 500,000. The reality is that we've put in a request for 7 million. We need millions more than that, in fact. Because remember, our first responders, our healthcare workers, you know, they're using them in the hospitals and sometimes reusing them for a couple of days even. But eventually they do need to discard them, and you need another one. And so we're going through PPE as a result of the need to replace these things. They're not permanent. And so 500,000 is not nearly what we asked the federal government for. It's not nearly what we need. Indeed, we have on order millions and millions of N95 masks, and we're going to continue to have to do that because the federal government fell down on the job.
And there were some reports, just to follow up on that, there were some reports in the reporting in the New York Times today about some of the masks that have been sent out to different states is unusable. Is everything that we've gotten from here in Illinois from the federal government, has it been able to be used?
Well, we became aware of ventilators that were sent to California. You may have heard this. And there was a celebration by the White House and, of course, by people in California that there were hundreds of ventilators sent to California. By the way, they need thousands, and so do we. But they received hundreds. It turns out many of them didn't work. Ventilators. Can you imagine sending that to a hospital and having that, you know, proposed for use on somebody who needs it at that moment, and then finding out that it doesn't work? So we now are going through every single ventilator. We received, I believe, a total of 450 ventilators. We assumed, frankly, that they would be operational. Why would you send us non-operational ones? But now that we've heard that other states have received some that aren't operational, well, we're going through every single one of those ventilators. The 500,000 N95 masks, and I think that's about the right number. I would have said 450, but 500,000 sounds about right. We check those. We spot check them. You can't really check every mask, but you know, we open the boxes and we typically will take some sample out of a box and just make sure that mask itself works, and that way we know at least those are good, and then we can move on.
Okay, this one is from Lexi from NBC5. Can you have the governor elaborate? Is wearing some sort of face covering a recommendation or a requirement? When should people wear them, in the grocery store or also out on a walk or run?
It's a great question. So there's not a definitive answer to this, and I said this yesterday. I believe, and if you've been in a grocery store lately at any time other than at 3 in the morning, you're running into a fair number of people. There's no reason to take any risks. And by wearing a mask when you go to the grocery store, for example, you're really protecting all the other people that are there as much as you're protecting yourself. In fact, more so. You're protecting other people from your droplets, and they're protecting you from their droplets by wearing a mask. So the question is it required? No, it is not currently required. It is a recommendation from me based upon what I have seen from the experts and scientists that have written about this. Now we've seen the CDC recommend this. So I believe it's a good idea when you go outside. If you're in an area where you're not going to run into crowds of people, it is perfectly fine to walk around and just breathe the air without having to wear a mask. But if you're going into an area, stopping at a gas station, at a pharmacy, at a grocery store, or heading to one, it's a good idea, in my opinion, to wear one.
Okay, I have 3 more from my colleagues here. This one is from Marissa, from your colleague, actually, BBM. In the wake of
then why are you here if they're asking questions? I'm just kidding.
In the wake of 2 Walmart employee deaths out of Evergreen Park and other confirmed positives from stores in Chicago, are there contingency plans in place to both, 1, further protect these employees, and 2, also prepare for a scenario where staffing at these stores may be an issue due to sick calls?
Well, we are encouraging certainly the essential workforce and the essential businesses that are open to all take care of themselves. The businesses themselves, they know that their workers are vital. Many of the businesses, in fact, have increased the pay to the people who are coming to work because they know that how vital these folks are. They want to give them an additional incentive. And I would suggest, as I have, that people wear masks in any circumstance in which they're going to be coming in contact with the public on a regular basis so that they don't get it, and again, that they're not giving it to anybody that they come in contact with.
Okay, this is from Ryan Burrow from WGN Radio, who is my colleague. We keep getting calls in the newsroom, complaints from people about conditions at senior living facilities and a lack of social distancing or protective gear at places of work like factories and postal facilities. Where do you recommend people call, or what should they do if they feel like orders aren't being followed and proper precautions aren't being taken?
I would make two recommendations. One is there is a Department of Public Health either in your city or in your county. And they should certainly be notified if there are groups of people, whether it's in an essential workforce situation or in public. If there are groups of people gathering, not wearing masks, and there's a danger to the people that are there. And there is, if there's a group of more than 10 people and they're not doing social distancing. So that's one thing that I would suggest doing. I think it's okay also to go to your employer, and if your employer's not listening, to go to another level of authority, and that might include your local elected officials or your local police department, to just say, look, it's unsafe, and here's what's going on. Again, as I've said, the police are not running around arresting people, but they are reminding people, and elected officials are doing this too, reminding people what the proper social distancing really is.
Thank you, Eric. I'm Mike Puccinelli from Channel 2, and I wanted to start by asking you about the Apex in Illinois. New York's been broadcasting when they think they're going to see their Apex pretty soon. When do you think we're going to see ours in Illinois?
Yep. So again, there are a variety of models to look at, and I'm not going to pinpoint one because they're all put together by experts at modeling and statistics, and so they can be a little off. But certainly I would say that most of the models that I've seen, and there are a number out there, say that we will peak somewhere between the middle and the end of April. And, as we move toward it, you've seen the numbers that we report every day. On one day you feel a little hopeful, on another day it feels like we're going backward. And so it's very hard to tell, what's actually happening unless you look at it over a time series. And unfortunately, over a time series, as you see, we're climbing the number of people who have it, the number of people who are passing away. And so, I don't want to predict on a certain day that we're going to hit a peak. But I will say that it's very important for us to track this. And the reason it's important to track it is, obviously, it helps us determine what to do with patients who are in certain conditions. Could we, for example, begin to transfer patients, should we, to McCormick Place? Should we, what are we going to do when you run low on ICU beds? You could, for example, add a ventilator and another piece of machinery to an existing bed that and turn it into a kind of a semi-ICU bed if in some particular place, ICU beds became unavailable. And then very importantly, every day, frankly, we are working all across the state to expand the number of available beds. Sometimes that means moving 2 beds into a room that used to have 1. Sometimes that means putting a tent onto the side of an existing hospital and adding, units there. And in many cases, it involves us looking to acquire every day. We are ventilators from everywhere that we can. And I feel like every ventilator at this point is a life saved. It's probably multiple lives saved. And so that's why we're working so hard at that.
On March 2nd on CBS, we had a Harvard epidemiologist on who said that he thought 40 to 70% of the world's population would ultimately come down with COVID-19. Do you have any determination as to what percentage of Illinoisans you expect that will ultimately get this?
So I don't. But I'll tell you the best that I can. If we had a vaccine earlier, then the answer would be a lower number, right? A vaccine later, a higher number. This virus knows no bounds. There are no boundaries that we can set here that says, you know, this virus won't cross the border between states or between cities or counties or between neighbors. This virus just moves to every human being that it comes in contact with. And so we certainly run the danger that the vast majority of Americans may end up getting this. And I guess the only hope that comes with that, the only hope, is that we're able to flatten the curve, meaning that people will get it over time and our healthcare system will be able to care for the people who get it and who have some serious illness in the process of it. And I guess, you know, again, if you look at the statistics, 80% of people who get it have, you know, very uncomfortable symptoms, some range of, you know, very uncomfortable to maybe slightly lighter than that, but recover. 80%. And then about 19%, and I'm sure that the doctor will correct me if I'm a little wrong, but I think I'm about right, about 19% have some range of something more serious that requires hospitalization for some period of days. And then a smaller percentage require an ICU bed, a ventilator, et cetera. 0.7 to 0.9%, it appears, who get it pass away. And again, if we have a treatment, this is very important. If you have to get a therapy or a treatment that gets approved, and there are a number that are being tested out in the world today, here in the United States and across the world, that some of which look more effective than others. If it gets approved, right, and that treatment is able to save lives, I mean, that's a game changer. And that would be before you ever see a vaccine. And it's not a game changer in terms of changing the number of people who will get it, but it's a game changer in terms of the number of people who will get sicker, end up in the hospital, end up in an ICU bed, or end up on a ventilator.
We'll do one more from the room, and then we got some online.
Are you frustrated that there are some states out there that still haven't gone with the stay-at-home orders?
I'm frustrated for the people who live in those states. I mean, I'm frustrated for us too. If you look at some of our border states who just went to stay at home or haven't even gone to stay at home yet,
Iowa.
then, you know, it's obviously this has an effect on Illinois. And so I would, you know, I wish, but let me be clear that while, you know, we can talk about those individual states, this should have been the job of the federal government to give guidance, in fact, to set orders for the country, because we know how this virus travels. We know it. I don't understand why the federal government has abdicated its role in leadership of addressing this virus.
Okay, and then some questions from reporters online. The president expanded the use of the DPA earlier this week. Is that enough? And do you want to see it play more of a centralized role in parts of production and distribution of medical goods?
Let me start by saying that as someone who used to be in business before I was a governor, I don't like the federal government or the state government or anybody interfering in the private market, generally speaking. But in a national emergency, for God's sakes, you know, the Defense Production Act is exactly designed for these kinds of circumstances. We are at war. It is a different kind of a war than we've ever had before against a virus, but we are at war. And we have the ability to produce PPE in this country and distribute it so that we have enough of it in every state as we need it. And we had the ability to produce enough ventilators so that we could reach at peak everybody that would need a ventilator in this country. But again, the White House failed to use the Defense Production Act to do this, to help us across the country. The White House. I can't invoke the Defense Production Act. They've only invoked it for a couple of individual circumstances, right? And it took them forever. When did they do it with regard to 3M and you know, it's just the other day, right? And then just 3 days before that, it was General Motors on ventilators. Well, guess what? If you ask General Motors, when are the first ventilators coming out? May? Well, most states, if you look at all the models, most states are going to peak, many anyway, are going to peak in April. And they could have started this in February, and we would have been fine. But we're not, and it's very upsetting.
How many additional field hospitals do you expect to get up and running in the next 2 weeks? How many beds total will those additional field hospitals have?
So these are the additional facilities that we've created. They're not really hospitals exactly, but but they are meant for people who are either convalescing coming out of a hospital, or, in some cases, it'll be for people who don't have COVID-19 and have some other ailment, and they'll be, again, convalescing, coming out of a hospital, but still in need of medical care. Those facilities, right now, it looks like if you look at the 3,000 beds that we expect to have at McCormick Place, and again, I want to remind people who live in other parts of the state that, because the outbreak is so significant in the city of Chicago, that having something that large at McCormick Place was very important. But we also have in outer areas of Cook County, which also have very severe cases, numbers of COVID-19 patients. There are hundreds. If I think about the 3 hospitals that looks like we're going to try to build out and are building out now, it ranges around 800 beds, I believe, in those other areas, 800 to 900 beds, and I'll correct that for you afterward if I've got it a little wrong. And then downstate in different areas, depending upon the outbreaks, depending upon the expected number of hospitalizations, it can range in any given area from 50 to 200 beds around in different places across the state, southern, central, and northwestern Illinois. So altogether, we're talking about 4,500 beds perhaps across the state. Maybe it's probably between 4,000 and 4,500 additional beds on top of hospital beds that already exist.
Illinois companies are threatening sick employees with their jobs if they don't immediately return to work, and these employees don't want to spread the virus but also can't afford to lose their job. What should these people do?
They should report their companies, because we won't stand for it. Companies that are demanding that sick people return to work, at this moment in our history, at this moment as we're fighting COVID-19, those companies should be reported.
And this will be our last question. The Adams County Health Department says 50 to 100 people were together at a party the day that your stay-at-home order went into effect. Some people at that party now have coronavirus. Why do you think people aren't taking this seriously?
Well, let me say that most people really are. The vast majority of people in Illinois are taking it seriously, and we should all be very proud of that. I think you see it, certainly if you live in Chicago or Springfield or Carbondale. You can see it. Just walk outside. It's Saturday. There are not very many people around. So thank you to the people of Illinois who are taking this seriously, and that really is almost all of you. Some people aren't. We saw that, on the lakefront in Chicago. We saw that in some parks in downstate areas of Illinois. And all I can say is that those people either are not paying attention to the news or they're stupid. That's all I can say. There's no reason why somebody should be ignoring this. You could be giving it to your own family, and you could get it yourself. And we're not asking much. We really are not. At this moment, we're asking you to stay at home to protect people for some number of weeks now, and you should listen, because you're putting everybody in danger.
Thank you, everyone.
Thank you.